Good afternoon to all. This is Speak Up Telangana. The budget for the COVID has not cost 4,000 crore. Telangana should learn a lesson from Kerala government. Today the Kerala government is doing the human service to the society. Telangana should learn from them. There are no proper safety equipments for the people who are on the way against the war against virus. Doctors, nurses, paramedical staff, and particularly who are working as ward boys, sanitation workers, or the fourth class employees. 50% of the posts are vacant in the health department, particularly in the medical professional. Nearly 50% of the staff is required and posts have not been filled after the retirement. There is no proper treatment for the patients. The government is at the mercy of private hospitals. None of the private hospitals have scaled down their charges, and none of them have the angle of humanity, and none of them have the respect for the government. The government or the private hospitals are not in a position to cater the need for the poor classes. It is literally the government of Telangana is the worst administrator as far as the health is concerned. Telangana government is an utter failure in the health sector. Government has come up with clarity. Government has not come up with clarity on the amount of donation Chief Minister Relief Fund has got. 50% of the Chief Minister Relief Fund has been knocked away. There is no security for the common man as for virus is concerned. Government has given up on its fight against virus. There are no COVID centers anywhere in the state except in the city. What is the fate of those patients who are suffering from virus in faraway districts like Khammam, Adilabad, and other faraway places? Why government is not converting district hospitals into COVID treatment centers? Let the government come up with the white paper on off. This government is more concerned about spending 150 crores to rupees 300 crores on Chief Minister's residence and decided to spend nearly 500 crore rupees on construction of a secretariat where the Chief Minister has never visited, and scam respect for government hospitals. And the glaring example is of Usmania Hospital. It reflects on the administration negligence and indifferent, arrogant attitude of the government. We want to re-emphasize the information with the government official bulletin of the government regards the COVID-19. It's not genuine. 50% of the death cases, positive cases, or the treatment are not being reported by the government. Why the government is not taking action against the private hospitals which are exploiting the poor masses? There are a number of cases where the patients have visited number of hospitals and they have not got the bed. Ultimately, they died in front of the hospital. There is no proper nourishment to the patients to strengthen their immunity, and there is no control on MRP, minimum retail price, or the supervision on the sale of medicines. There is no hard and fast medicine for this COVID-19, and we do not know when the vaccine will come out. So it is a bloody duty of the government, responsibility of the government to see that each patient, depending on the intensity of the virus affected the patient, is in quarantine, admitted or treated intensively and given the proper nourishment to strengthen the immunity system. And whatever this government is speaking is all nonsense. That spending rupees 3 lakhs on each patient is nothing but all is nonsense. As the CM Chief Minister in the Assembly has said that the viral will not survive after 22 degree. The same chief minister even said that his party MLAs and ministers will fight the virus and they are not afraid of the virus. And same chief minister said, we are ready to spend crores of rupees to protect the citizens. What happened to that money? What happened to the MLAs? What is the fate of the hospitals? What is the standard of the hospitals? And where do the common man stand in this government? Not even a single new hospital for the public is constructed since the inception of the Telangana, since last 6.5 years. Whereas the same bloody government has been spending 1,20,000 crores on a project, 40,000 to 50,000 crores on Mission Bhagirath, put together comes to 2 lakh crores. Why? This government has neglected the health sector, which clearly implies that this government is interested more in commission than serving the people. Thank you.